In communities where access to proper health care is already a challenge, the COVID-19 pandemic is putting an added strain on hospitals. At Reedsburg Medical Center in Sauk County, more patients are being admitted with COVID-19 than any other diagnosis. Tahlil Mohadeen spoke to officials at the hospital and shares what they're doing to try and keep up.
Staff at Reedsburg Medical Center in Sauk County say they're looking after familiar faces.
We're taking care of our friends and neighbors here in rural communities, people that we see out in the grocery store.
A relationship that makes it especially hard to deliver bad news.
It's very difficult to know that maybe we want to get this patient somewhere else to get a surgery that we can't provide here or a specialist that we can't provide, but that isn't necessarily always a possibility right now.
With 97% of ICU beds in Wisconsin in use, Reedsburg staff are working overtime to get their patients the care they need.
On some days we make 30, 40, maybe even 50, 60 phone calls. We're calling into Iowa. We're calling to Minneapolis. We transferred a patient a few weeks back down to Rockford, Illinois.
But as COVID-related hospitalizations continue to rise, waiting for a transfer spot may take a while.
In the past, 2 years ago, it was unlikely for us to keep an intubated patient in our facility. Now this is a common occurrence for us.
To fill the gap, Reedsburg medical staff say they're stepping up and learning a lot.
We're having to ask a number of questions. We're having to reach out to other physicians, other experts in the field to get the best advice because, you know, there are things that we are not equipped or trained to do.
In a county where 43% of the population is unvaccinated, hospital staff say they'll hang on as long as they need to.
We'll hang on as long as we need to for our community. That's the pledge that we have, but it definitely is going to be difficult.
In Reedsburg, Tahlil Mohadeen, News 3 Now.
Medical staff say the best thing you can do in addition to getting the vaccine is stay on top of your primary care. This will mean keeping up with your regular doctor's appointments, which will in turn keep you out of the hospital and lighten their patient load.